Coming up in this edition of Eye on SADC, Eswatini records 6 more cases of COVID-19. Also, Namibia's economy expected to decline by 6.9% this year. And mass screening for coronavirus in Lusaka's Makeni area has been extended. This is where we bring you the latest happenings in the SADC region. A very good day to you and yours, and welcome to Eye on SADC with me, Ndishishi Hamfungo. First, we start in the Kingdom of Eswatini, where Health Minister Lesotho Nkosi has announced 6 more cases of COVID-19 in the kingdom, which brings the total number of cases to 71. She made the announcement at a media briefing in Mbabane.
The Minister of Health, Lesotho Nkosi, says the ministry on Tuesday received a total of 143 results. 137 results came out to be negative and 6 came out to be positive. The number of people who have COVID-19 in the country stands at 71. People who tested positive on Tuesday include 2 from the Lubombo Referral Hospital and 4 from the Manzini region.
Case number 66 is a 57-year-old female from the Lubombo region. She's a clinician. Case number 67 is a 24-year-old male who is in the Manzini region. He has no history of travel. Case number 68 is a 25-year-old female of Manzini region. She also has no history of travel. Case number 69 is a 47-year-old female from Manzini region. Case number 70 is a 32-year-old man from Manzini region. Case number 71 is a 45-year-old woman from the Lubombo region.
The Ministry of Health conducted a mass testing exercise in the Manzini region on Monday, and 49 cases turned out to be suspected cases.
We managed to screen hundreds and hundreds of people. I do not have the exact number, but we tested 49 people yesterday. We screened and found 49 suspected cases yesterday that are now being taken to isolation, and will continue to observe them.
To date, the country has recorded 1 death, 10 patients discharged, and 54 patients who are still being treated.
Remaining in Eswatini, Health Minister Lesotho Nkosi further announced that government will recruit 293 health workers to assist in the fight against COVID-19.
The Minister of Health, Lesotho Nkosi, says the ministry asked for government's assistance after realizing the strain caused by COVID-19 on health personnel.
And these are as follows. We are going to get general nurses. We're going to get 90 general nurses, 15 staff nurses, 10 laboratory technologists to speed up the work in our laboratories. We need a network engineer to strengthen our surveillance. We need a computer programmer. We'll have 2 of those. We're going to have 54 orderlies that will help keep our hospitals clean. We'll have 5 medical officers, 5 computer analysts. We will have 4 M&E specialists. These are people that are going to try and keep us on track in the work we're doing through monitoring. We're going to have 10 radiographers, 30 paramedics, 10 pharmacy technicians, and 50 nursing assistants. Altogether, we are going to be hiring in the next few days. In the next week, where possible, we're going to be hiring an additional 290 people into the health service.
The minister concluded by extending her gratitude towards people who assist the government in the fight against COVID-19.
Lungelele Magagula bringing us those updates in the Kingdom of Eswatini. Now, Namibia's economy is expected to decline by 6.9% this year, following a slight drop of 1.1% in 2019. This is contained in the Financial Stability Report jointly issued by the Bank of Namibia and NAMFISA.
The economy is projected to experience a significant downturn of 6.9% this year, with a slight recovery of 1.8% expected next year. According to the Director of Research at Bank of Namibia, Floretta Nakosera, risks to domestic growth are dominated by ongoing travel restrictions and disruptions to the supply chain. Other risks to domestic growth and outlook include the volatile and persistently low international prices of some of Namibia's export commodities. According to the IMF's World Economic Outlook for April 2020, the global economy is also expected to decline substantially by 3.3%. This is a sharp contrast to the positive 3.3% that was projected before the outbreak of coronavirus. The downward revision to 2020 growth is largely attributable to anticipated lower industrial production and volatile commodity markets, primarily due to the worsened impact of the COVID-19 outbreak. Global output, however, is projected to expand by 5.8% in 2021. But for this year, output is expected to drop in both advanced economies, emerging market, and developing economies. Despite the gloom in terms of economic growth, Namibia's financial systems remained sound and resilient despite unfavorable domestic and global economic conditions in 2019. However, the decline in financial stability emanating from COVID-19 pandemic has a negative potential income to the liquidity of households and businesses. The financial stability of banks and non-bank institutions may also not be spared by the COVID impact. Nakosera, nonetheless, says the authorities are closely monitoring the situation so as to adopt further policy measures to ensure financial stability if need be.
Now, the transport sector in Namibia has been heavily affected since the state of emergency was declared more than a month ago, with Air Namibia, the country's national airline, having generated zero revenue as all its flights have been grounded. The executives in the transport sector discussed the impact of the pandemic on their industry at the COVID-19 Communication Center situated in the capital, Windhoek.
All aircraft at Air Namibia remains grounded, meaning no business for the company.
The aviation industry is going to lose more or less $113 billion by end of March. Now that figure is almost doubled to $220 billion as we speak. So if you ground your aircrafts, it means you have zero revenue generation. So there are now what we call the indirect impact associated to the operations of Air Namibia. And these indirect impacts boils down to the supply chain.
Despite the lack of revenue, the company says employees at the airline will still receive their salaries over a short term.
Now we need to remodel again, because if you look at the neighboring country, for example, South Africa, with the largest fleet, it's in a serious problem. So we are seeing opportunities in that area, in increasing frequencies, for example.
For the past few weeks, business at Trans-Kalahari also reduced with 60% due to the fact that certain commodities are not moving.
A simple example, of course, the airlines are not flying, so they're not taking fuel. Nobody is driving, or almost nobody is driving in country, so the fuel, the volumes has moved down significantly over the past few weeks.
Namport's acting chief executive officer, Kevin Harris, says the company remains operational, though affected by the pandemic as well.
In terms of the landside operations, we have also seen quite some delays in the rate at which cargo comes into and out of the port. But on the whole, we remain operational, and we're obviously prioritizing what we term to be essential cargo.
The Deputy Executive Director in the Works and Transport Ministry explains the process followed by trucks transporting essential products.
It is a situation across the region that once a driver is screened, they are then allowed to move, to proceed, and to deliver the goods. The quarantining measures only kicks in. For instance, if someone is delivering goods between Namibia and South Africa, comes into Windhoek or Shakati, wherever they are delivering, and they have a day or 2 days before they undertake the next trip, they are then required to be quarantined for the period that they are here before they proceed.
An outline of the impact of COVID-19 on Namibia's transport and logistics sector. We now move to Zambia, where mass screening for coronavirus in Lusaka's Makeni area has been extended.
Testing for COVID-19 is key in the fight against the disease, and health authorities are not slowing down in rolling out mass screening and targeted testing in affected communities. In Makeni, testing for COVID-19 went into the second day.
We needed to continue because quite a number of people did not know, so we started doing social mobilization from Saturday, yesterday and today, and we expect more people actually to come through today and be tested for COVID-19, because this is the best strategy. We want to know if someone has COVID-19, we can easily isolate them and stop spread to other people, and by so doing we'll be able to stop the spread to the community members.
Chansa Sakwanda will be turning 17 on 23rd June. Today, she came with her grandmother to take the test at Makeni Ecumenical Center, one of the sites where tests were being conducted.
Well, I was just curious to know my status, and that's what moved me to come here. I would advise them to come and test so that they can know where they stand, and if they have it or they don't need to be curious about it, they'll be cured.
It's not scary, something that one can do. And it doesn't even take long, just seconds.
There were others that took the test.
We've heard a lot about this disease, so we just wanted to find out if I'm okay, so that I don't infect others in my family.
This disease is not selective. It goes to anyone, and moreover, for someone to be known, it takes time.
But at Simon Mwewa, the process started on a slow note. The Muslim community is helping with the coordination of screening and testing.
If this exercise can be intensified to an extent that it should be done faster to cover each and every citizen of this country, especially the residents of Lusaka, before they start mixing, with other people who are not around. So for that, we are very, very grateful.
On Tuesday, health workers will be moving to Kamwala and Madras, and they are hoping that many will turn up to take the test for COVID-19.
Some of the efforts there in Zambia. Meanwhile, Health Minister Chitalo Chulufya has clarified that the COVID-19 case recorded in the Copper Belt yesterday, that was on Tuesday, was a double count, which is a sample of a Masaiti-based patient. Now, Dr. Chulufya says the cases on the Copper Belt therefore remain at 4, with 39 in Lusaka and 1 case in Kabwe, bringing the total number of active cases to 44.
Zambia's COVID-19 cases have continued to steadily rise, with the number now standing at 89, following 2 new cases recorded in Kafue district. Health Minister Chitalo Chilufya, at the daily COVID-19 media briefing, revealed that the new cases that include a 13-year-old child are contacts of another positive case.
The 2 individuals have been moved to their facilities, and a new generation of contacts is being tracked. Cumulatively, we have 2,942 people that have been discharged from the 14-day mandatory quarantine.
However, 1 case on the Copper Belt has been ruled out after being discovered to have been a retest of someone already quarantined. While stating that government has heightened disease surveillance and testing, Dr. Chilufya advised Zambians not to weaken their guard against other serious diseases like malaria, tuberculosis, and HIV and AIDS.
TB and HIV/AIDS are still public health challenges in the country. And as we combat COVID-19, let us remember all our responsibilities in order to avoid contracting HIV/AIDS and getting TB.
And various cooperating partners have continued supplementing government efforts with the All-Weather Friend, the Association of Indian Community, donating 24,000 face masks and thousands of test kits.
20,000 swabs for PCR tests. This will allow your ministry to test 20,000 samples. 1,900 rapid diagnostic antibody tests to assist the ministry in prevalence mapping.
Red Sea and Godfathers also donated 100,000 kwacha. Betway came in with health equipment and sanitation aid with over 100,000 kwacha, while Java Food supplemented government with nutritional needs.
We're going to donate 1,600 packets of HEPs, as well as 3,000 single-serve packets of HEPs as well. And the reason why we're doing this is we want the isolation centers to also be able to access this, but also the vulnerable communities.
Dr. Chilufya reiterated government's commitment to transparency and accountability for the donated items, as it heightens the fight against the pandemic, which has so far claimed 3 lives in the country.
Brian Mwale with that report. We are watching Eye on SADC, and here's what's still to come. Eswatini's central bank donates personal protective equipment to health professionals. Various sport code players face a loss of income due to COVID-19 and preventative measures. And first, Zambian President Kenneth Kaunda celebrates 96th birthday. That's what's still ahead after a quick look at the day's economic indicators. We'll be right back. Welcome back. We continue with more news. Now, the Central Bank of Eswatini has donated personal protective equipment for doctors, nurses, and healthcare support staff valued at $46,000. The governor, Majosi Sitole, says it is important for all sectors to support government during the outbreak of COVID-19.
Last week, the Deputy Prime Minister Themba Masuku said government is having difficulty to procure personal protective equipment for healthcare workers as every country battling COVID-19 across the globe is buying it, leading to its shortage. As a way of meeting government halfway, the Central Bank of Eswatini has donated personal protective equipment to the value of 860,000 emalangeni to the Minister of Health, Nkosi.
We know that as a bank, what we are contributing will not be enough against the total requirement of the ministry. Even then, the bank is only able to deliver today half of what it selected from the ministry's list due to glitches in supply chain and logistics. We await delivery of the remaining half, and as soon as that arrives, we will hand it over to the ministry as soon as possible. Due to the urgent need for the personnel protective equipment, we felt we could not wait for the full delivery, but to hand over what is already available.
The Minister of Health, Nkosi, said the equipment donated by the bank would be of great help since the ministry does not want to lose its staff in the line of duty fighting against the spread of the pandemic.
On behalf of government and on behalf of the ministry, I would like to thank you and the institution for continuously being there, for being responsive to the needs. The question of protective equipment for health workers has been one that has been really troubling us from the very beginning. One, as you know, that the market is already chock-a-blocked, so it's very difficult to find these things in the market to begin with. Secondly, the prices in the last 8 weeks have skyrocketed.
The minister said the central bank contributed 130,000 emalangeni towards the laboratory at Mbabane Government Hospital established to do tests for suspected COVID-19 cases.
Namibia's Deputy Minister for Sport, Youth and National Service, Emma Kantema Gaumas, says sports in Namibia is faced with a loss of income due to the emergency measures implemented during the COVID-19 pandemic. Now, the sector